so excited. Again, this is Lolita, the founder of My Natural Me, and of course, the Dementia Caregiver Support Program. And we're here for some more quick tips. I love being able to do these videos because, as we were talking before recording this, just how important and how needed it is. So I am excited to have Miss Chelsea here with us. And Chelsea, of course, you can go ahead and share just your expertise because, of course, I'm just going to say like Medicare expert, but that's not really officially the title. So go ahead and let people know just who you are. And again, thank you so much for having this conversation with us.
Yeah, absolutely. No problem. No problem. So my name is Chelsea Belay. I am out of Atlanta, Georgia. Just moved to Atlanta recently. I'm originally from Northern Virginia. So our team is licensed in both states and all other states in between. We help families with all different types of insurance, you name it. Life insurance, health insurance, retirement planning for, caregivers who may be a little bit younger, mortgage protection to ensure families don't lose their homes in the event of a medical crisis, which we do see a lot of families do, unfortunately. So we kind of help, families from a bit of a more proactive approach. And of course, Medicare is something that we help people out with as well. So those are the main five, the main
Yeah.
five ways that we help families out.
Beautiful. And of course, this whole conversation really started around talking about Medicare, but in our conversation, like you were saying, some of these other types of insurance that you all help people with are really important for caregivers. And again, we in this particular program, we're focused on the caregivers because strong caregivers really can help the individuals with dementia, right? I'm not on the medical side of trying to figure out, what medication is best for this or that, but when we can arm and inform the caregivers to be able to get the resources and get the things that help them also help our loved ones that are dealing with dementia. So of course, we're going to be kind of talking about some quick tips for Medicare, but we will definitely be doing more of these conversations. And I encourage people to reach out directly to Chelsea and her team because you really want to find out what other ways that your insurance can benefit you as a caregiver. So with that said, let's get into it. Let's talk about some tips that we can share regarding Medicare and helping our caregivers.
Yeah, absolutely. So really quickly, a couple misconceptions that I have written down here about Medicare is one, people think that it's an automatic process. Like as soon as you retire or as soon as you turn 65, the Medicare fairy comes and deems you enrolled. But that's not the case. It is something that you do have to enroll in. You physically have to enroll in. So whether it be the Medicare eligible resident themselves, or in this case, the caregiver, we always encourage you to reach out to us directly, especially this time of year, because there is an open enrollment time frame that's going to be approaching this fall. So now is the time, like late summer, early fall is the time to start having those questions with a person like myself, a licensed agent, so that when open enrollment does come, we can ensure that the residents' needs are met and the family and caregivers' needs are met as well, so that no one's paying out of pocket for anything unnecessarily. So it's not something that's automatic. It is something that you do have to enroll in. Another thing that I have written down here is that Medicare does not provide long-term care. So long-term, extended care, home health, things like that, Medicare does not help with those. It does, however, help with post-hospital stay. So like rehab or rehabilitation after an extended hospital stay, Medicare does help with some of those costs and ensure that the family has what they need to get that person, rehabilitated properly. But as far as extended care or long-term care, that's not something that Medicare helps with. That's one of the biggest misconceptions that we see, because we do have a lot of people calling in asking for long-term care options when we do have to kind of, direct them otherwise, because that's not something that Medicare helps with. Another big one is that one size does not fit all. So the plan for your cousin that works so perfectly for them in their situation may not be a plan that you qualify for. So again, that's why it's so important to speak with an agent like myself or my husband to ensure that the plan that you have fits your specific needs. There's no one size fits all. It's always good to speak with someone to tell them what it is that you're looking for in a plan, what it is that you like, whether it be dental, vision, prescription, drug plans, medication, things like that, so that we can help you find a plan that's specific for you. Like we mentioned earlier, there is an open enrollment period. So that open enrollment period every year, every single year, is going to be from October to December, October 15th to December 7th. So we always tell people to start having those conversations with an agent like myself. As we mentioned, like August, I would say August 1st is a good time to start. Write down what's important to you, what you need, whether it be additional services, government funded services, or, you know, help with vision, help with dental, help with prescription drugs. Like, write down what you're looking for to get out of a plan, and then schedule a time to talk with us, one of our teammates, so that we can get you enrolled by October 15th. So you don't want to wait to start looking at on October 15th. You want to be enrolled by October 15th. So starting to have those conversations with us anywhere between like August 1st and October 1st is always a good thing, so that we can get you enrolled by October 15th without any issues. Let's see, what else do I have here? Yeah, those are my top tips.
Yeah.
Those are the big ones.
Right. And you know what's so good about that? So in our caregiver support group, I hear so often that once the caregiver kind of, now has to take over, right? Oftentimes they are not satisfied with the medical care. Again, I've heard so many times that the doctor hasn't been helpful, the neurologist hasn't been helpful. They're looking for, better prescription coverage, all of that. So this is so good to know that, one, there is an open enrollment time period. And then, as you said, to really start the conversation with an agent like you right away so that you can outline everything that you need, what you would like to see better. You will be able to assist us, I'll say, with knowing, okay, this is in the plan, it's not in the plan, what you can do about that. But it's really good to talk with someone like you, and especially as the caregiver jumps in and is just completely not happy with what they see the person dealing with.
Absolutely. Yeah. That's a big one. And that's part of the reason why I do like the open enrollment period. It's just like any other type of insurance, right? There's an open enrollment for a certain window. Is that it's kind of like that light at the end of the tunnel.
Right.
So whether you're approaching 65 and Medicare is new to you, or you're already enrolled in Medicare, but there are certain things that you definitely want changed. It's that 6-week window, October 15th to December 7th, is kind of like the light at the end of the tunnel, the day of atonement. You get to start fresh.
Yeah,
You get to
yeah.
start fresh in a brand new plan. So give us a call before that time frame. Like we said, starting around August 1st is when we start to set up our free consultations. And we're more than happy to help you, whether you're new to the Medicare world or whether you want to see some changes in your plan or anywhere in between. We're here to help out in any way that we can.
I love it. And just a quick question. So, if a caregiver is starting this process and they want to reach out to you, is there anything such as, power of attorney or anything that they'll need in order to handle this business for their loved one?
That's an excellent question. Yes.
Okay.
So our consultations are free. There's no paperwork involved. There's no consultation fee. There's no service fee. We get paid directly through the insurance companies. So you can talk with us as much as need be until you feel comfortable with the plan that your loved one is enrolled in. But when it comes time for enrollment and the paperwork does need to be signed, you will need to have either a power of attorney or a medical power of attorney in order to submit paperwork on your loved one's behalf. So you don't need to have anything to speak with us. We're here to help. We try to make things as smooth as possible. But when it does get time to submit paperwork, yes, those insurance companies will ask you for that.
Great. Awesome. Well, I know this is our quick tips. Be tuned in for more quick tips with Chelsea. And then, of course, let people know, because I strongly encourage, if you are watching this video and you have questions, please just go directly to Chelsea. Don't get lost in the search holes and all that. Just go directly to Chelsea and her team. As she mentioned, this is free, so you can get your questions answered and you can do what's needed to help your loved one. So Chelsea, how can they find you and your team?
Absolutely. Yeah. So our email address is Belay. So my last name, Belay, insurance group, all one word, Belay insurance group @gmail.com. And you can also give us a phone call anytime. Our phone number is 470-920-0626. And I'll say it again because people say I talk too fast. So one more time, it's 470-920-0626. Feel free to call us anytime. And if we don't answer right away, please, please, please leave us your contact information and we'll get back to you.
There you have it. Well, Chelsea, thank you so much for your time today. I know this is a busy time for you as well, so I appreciate that. And of course, like I said, they'll be able to find your information on our website too. I really just want our caregivers to really have this information. So thank you for your time. And of course, we'll be chatting again soon.
I'm looking forward to it. Thank you.
All right. Bye.